So today's topic is microminerals, part 2. Those who have the textbook, please mention the page number in the chat box. There are two chapters of microminerals. One is micromineral iron, and another is part 2. Page 271. If anyone is joining late, please help them out with the page numbers. So first micromineral is copper. We'll discuss about copper. Copper is necessary in trace amount for the formation of red blood cells, collagen, energy production, your neuron signals to pass through, okay, for your immunity, and even for iron metabolism. Copper as a micromineral is important, okay. And if you lack copper, that could also lead to anemia, neuromotor deficiencies, okay, issues in immunity. And also apart from this, it acts as a cofactor for various enzymes. Cofactor means the presence of copper is required for your enzymes to work, okay. So a lot of enzymatic activities in humans, okay, it is required. So copper is also involved in your metabolism, especially lipid metabolism, okay, for the breakdown of lipids. Otherwise, your body will not able to metabolize fats properly. And that is if in case of children who are suffering from malnutrition, copper is also present in a lot of ORS solutions, okay. And it's an opponent for zinc, okay. If there is too much of copper, zinc will not be absorbed, and if there is too less of copper, too much of zinc is there, the copper will not be absorbed, okay. They don't complement each other. So copper metabolo enzymes, first you have tyronase, okay. Tyronase is an enzyme uh, which is involved in the production of your melanin, okay. Tyrosinase. So that controls your melanin reaction, production of melanin. The amount of melanin that you have determines your complexion, your sleep pattern, okay. And tyrosinase is not a single enzyme, it is a group of enzymes, okay. And this also protects your body from UV radiation because melanin is produced. If melanin is produced, you are protected from UV radiation, okay. Next enzyme is cytochrome C oxidase. Cytochrome C oxidase. So this enzyme is also a protein complex. Okay. The function of this in human body is to make sure that cellular respiration takes place. Okay. So because of this, oxygen can be used up by your cells. Because of the presence of this enzyme, oxygen is able to be used up by your cell. And if cytochrome C oxidase enzyme is not present abundantly, you are breathing, you have oxygen in your body, but your cells are not able to use it properly. Okay. So that is the function of cytochrome C oxidase. This is also a copper metaboloenzyme. Copper as a cofactor is required for this enzymatic activity. Okay. Next is lysyl oxidase. Lysyl oxidase. So this is also encoded in your human gene. Okay. And it is also important in making sure the lysine is made into an aldehyde. Conversion of lysine into aldehyde. Lysine is a kind of amino acid. Okay. And it makes sure that your body is not producing cancerous cells. Okay. Tumor cells and all that can be regulated. And it can prevent any tumors from becoming malignant or cancerous. Tumors can turn cancerous, okay, within your body. So because of the presence of lysine oxidase, there is a control over how many irregular cell differentiation is taking place in your body. And this is also involved in production of collagen in your skin. Okay, elastin and collagen fibers that keep your skin healthy, plump. Okay. For the formation of these two fibers under your skin, lysyl oxidase is required. Next is superoxide dimutase. So, one second. So, superoxide dimutase, this functions like an antioxidant. Okay. It protects your body against inflammation, oxidative stress. And there are certain diseases in humans that takes place because of too much of oxidation. Okay. So superoxide dimutase can take care of that. Any genetic disorders like some sclerosis, Huntington's disease, Parkinson's disease, Alzheimer's, okay, these diseases can take place if you don't have enough superoxide dimutase in your body. It's in short form, it is called SOD. Superoxide dimutase, in short, it is called SOD. Diseases like Alzheimer's, Parkinson's, Huntington's disease, sclerosis, okay, lateral sclerosis, not multiple sclerosis, lateral sclerosis, these kind of neurodegenerative disease can take place because of copper is required for the transmission of neural signals. Okay, so in the absence of this enzymatic activity, neuron related diseases can take place. Parkinson, Alzheimer's, sclerosis, these all are neural disorders. Okay. Then you have monoamine dimutase. Sorry, monoamine oxidase. So they remove certain neurotransmitters called norepinephrine, serotonin, dopamine from your brain. Okay. In certain psychiatric medications also it is used when there is too much of epinephrine, too much of dopamine, serotonin. Okay, that can be removed from the brain. Okay, too much of the secretion of dopamine, epinephrine can lead to maniac like disorders. Okay, so when the neurotransmitters like norepinephrine, dopamine, serotonin, it is not required in only in controlled doses. Your brain should produce it. Okay, when there is too much of it, monoamine dioxidase will take care of it. It will help in the degradation of excess amount of norepinephrine, serotonin, dopamine. Okay, otherwise the person may go into a maniac kind of a situation. So these are the main enzymatic activities where copper is required. Okay. Is it clear to all the enzymatic activity of copper? So copper absorption, majority of the copper absorption takes place from your small intestine in the duodenum. Okay, in the end of the duodenum itself, in the jejunum. Okay, copper absorption takes place. Usually, copper comes from your dietary intake. Okay, main source of copper, we'll discuss that, but liver, fish, nuts, chocolate, okay, these all are good sources of copper. And from the intestine, it goes into the blood. And if it has to travel in the blood, copper is bound by a protein. There is a protein copper combination. Okay. The albumin is a protein that is found in blood serum. Okay. So there is a albumin and copper combination because of which the copper is able to travel in your bloodstream. And through that, it will reach your liver. Okay. Copper is stored in the liver in the form of hepatocyprin. Okay. So that's how the absorption and the transportation of copper takes place. If you have malnutrition, proper absorption of copper will not take place from the small intestine. And if there is a lack of protein, if there is a lack of albumin in the blood, again, the copper will not be able to travel through the blood. And major sites of copper absorption is your duodenum and ileum. Okay, the first two parts of your small intestine. And it is stored in liver in the form of hepatocyprin. So this is what you have to remember. Copper deficiency, it's very rare, okay, until and unless a child is malnourished, okay. Copper deficiency, hypocupremia is also the other name of it. So clinical features of copper deficiency: sparse, kinky hair. The child is not able to reach developmental milestones. Certain age, certain developmental milestones a child has to attain. Okay, like the first few developmental milestone is able to uh, catch hold of something and release it. Okay, having control over head movements. Okay, these all are developmental milestones. Able to crawl, sit upright, walking, running, making sentences. Okay, so these are developmental milestones. So that will not be possible. Truncal hypotonia, muscle tone will not be there. Okay. Hypotonia means there is no muscle tone, lack of muscle tone. Okay, it is also a rare condition. There is a delay in speech. Okay, usually why this happens is that why truncal hypotonia happens. The child's body is not able to utilize oxygen. If you see in one of the enzymatic activity, okay, certain enzymes were required to break down the oxygen to make sure your mitochondria, your cells can use oxygen. Okay. And in the absence of copper, these cells will not be able to utilize oxygen. So there is a lack of oxygen, and that could lead to hypotonia. Not able to lift their head. They are not able to control their neck movements because there is no tone, no muscular tone there. Okay. Failure to thrive, not able to develop properly. Epilepsy is fits, convulsions, seizures. When you do the blood sampling, when you do the lab testing, your blood samples are tested, it will show low serum copper and the low serum ceruloplasmin. Ceruloplasmin is the copper albumin combination which carries copper through your blood till the liver where it gets deposited, where it is stored. Okay. So when there is very less amount of ceruloplasmin, which means that there is less amount of copper protein complex. Okay. So there is a lack of copper. Treatment, copper chloride is given. Copper sulfate is also given these days. Okay. And L-histidine injections are given. The dosage of these tablets or medicines differ. Okay. In syrup form, when copper is given, 300 microgram per 15 ml is prescribed. If in tablet or capsule form, if you're giving copper sulfate, okay, 100 microgram per capsule is given. Mac total syrup, supradin syrup, aquamin syrup. Okay, these are the different syrups or capsules also with the similar names are given for children. Usually the children who suffer from protein energy malnutrition, in them copper deficiency is seen. It's not that common. It's a very rare condition. And other symptoms that copper deficiency can produce is neutropenia, less amount of neutrophils in your blood. Okay. Anemia, uh, hair that does not have enough color, hypopigmented hair, osteoporosis, soft tissue calcification. Calcium get deposited in soft tissues like your muscles, eyes, brain cells, okay, like where it is not supposed to be there. And in some cases, if you are giving too much of zinc supplementation, okay, if you go behind too much of zinc supplementation, that can bring copper deficiency, because if you remember, copper and zinc, they compete with each other for absorption. So when there is too much of zinc in your diet or in your supplements, that will not allow enough amount of copper to be absorbed. Okay, so excess of zinc supplementation can lead to copper deficiency. Is it clear to all so far? So next is copper toxicity. Too much of copper, okay? It can be caused by consuming too much of acidic food, which is cooked in copper vessels. Okay, if you are using copper cookware and you are cooking acidic food in copper cookware, that could lead to copper toxicity. Drinking water only from copper vessels. Okay, nowadays copper bottles and everything is available, and you drink your water only from these kind of vessels. That could also lead to copper toxicity. Too much of copper supplementation. So these are the common causes, and it's called Wilson's disease. Menkes disease is the deficiency of copper. Wilson's disease is the toxicity of copper. So these are the symptoms you see here in copper toxicity. The person will have fever, pain, chills, that is shivering, okay? Jaundice. Too much of copper will be stored in the liver. It will cause inflammation in the liver, okay? Hepatocupurin is the form in which copper is stored in the liver. But too much of copper in your system, it has to be deposited somewhere. So it goes into your liver and causes issues with your liver. So jaundice will definitely take place. That's what yellowing of eyes and skin. Okay. There is a metallic taste in your mouth. Anemia, the person may go into shock. Okay. Convulsions can take place because copper is involved in the neural signaling. When there is too much of signaling, uncontrolled, that leads to epilepsy, convulsions, vomiting, nausea, abdominal pain, burning sensation. Liver is not able to function properly. Okay. Kidneys, there is no urine production. Diarrhea, there could be bloody or bluish diarrhea. And in Wilson's disease, even in your eyes, okay, there is a circle of copper that is deposited in the in the circumference of your iris. Okay, so that is also seen in Wilson's disease. Even in your eyes, copper metal will get deposited. Okay. So that is called Wilson's disease, copper toxicity. Even if you are having enough amount of copper per day, okay, because of certain genetic defects, copper is not excreted. Okay, all the forms of copper is taken up by your body, and that leads to Wilson's disease, copper toxicity. And this is usually a genetic defect in which an enzyme is not produced, which is supposed to excrete the excess amount of copper from your body. Okay, so all the forms of copper, it stays back in your body, causing toxicity. So RDA of copper, daily allowance of copper, is just 2 mg per day. 2 milligram of copper per day is the recommended allowance for majority of the, like for adults, children, everyone. Okay. The best sources of copper in animal sources, you have oysters, shellfish, and liver. Okay, any animal liver is a good source of copper, because even just like in how in human bodies we store copper in the liver in the form of hepatocorporin, animals also store copper in their liver. Okay, so these are the animal sources, best sources of copper. And in the plant-based sources, shiitake mushrooms, quinoa, almonds, cashew, lentils, chia seeds, sesame seeds, raisins, avocados. Okay. So these are the good sources of copper. Lentils on a daily basis is good. Lentils and legumes, they also have copper. If you're having a balanced diet, there is no requirement of taking copper supplements. Even black pepper, cocoa plant, that is chocolate. Okay, having chocolate is also a good source of copper. The cocoa plant, prunes, and some forms of yeast used in baking is also a good source of copper. Chocolate, that too dark chocolate. So about copper, is it clear to all? So next is fluorine. So it is a negatively charged ion. Okay, and 95% of fluorine in human body is present in bones and teeth. Okay, because it is required for your bone health. It keeps your teeth hard, the enamel of your teeth hard. If the enamel is soft, that's when you get dental cavities and all. Okay, it is good for oral hygiene, protects your teeth from dental caries. It also stabilizes the structure of your bones. It is required for bone mineralization as well. It's a very important component of your bone and teeth. And the best sources of fluorine is your drinking water, seafood, tea, cheese. Okay. 1 parts per million is the normal content of fluorine in drinking water. That is desirable. If there is too much of fluorine in your drinking water, which means if there is too much of more than 2 to 3 parts per million of fluorine in drinking water, that would lead to chalky white teeth, fluorosis, what we call fluorosis of the bone. We will see about that. And when you're using the RO water filter, reverse osmosis water filter, okay, that can take care of defluoridation. Okay, defluoridation can be done if you're using RO water. Okay, reverse osmosis filter is available to you, that can take care of your defluoridation. Okay, and in India also, like we had the Nalgonda situation in Andhra Pradesh, Telangana. Okay, where there is the too much of fluorine was present in their groundwater. Naturally, too much of water was present in the groundwater, and that led to fluorosis in the entire population. And that was rectified using alum and lime. We'll come to that. Okay. And in Maharashtra, jowar consumption is high. Sorghum consumption in areas, in regions where you consume a lot of jowar, sorghum. Okay. There also fluorosis is seen. Excess consumption of jowar can also lead to fluorosis. So absorption of fluorine through your GI tract, okay, from your small intestine, it is absorbed. It directly goes into your plasma, that is blood plasma, in your blood circulation. And from the plasma, it goes into soft tissues. It goes to your teeth. It goes to your bone, that is calcified tissues. Okay. From there, it goes to your salivary glands. Okay, it's there in your saliva. Okay, uh, excess of fluorine will be taken out from your body through feces, excretion, even through sweat, urine. Okay, too much of fluorine, if it is there, through your saliva, through feces, sweat, urine, it goes out of your body. Okay, what is retained? The number of fluorine that is retained, 95% of fluorine is found in your calcified tissues. That is your bone and teeth. Okay, only 5% fluorine is seen in the soft tissues. So RDA 1.5 mg per liter of drinking water is the normal limit. Okay. Water testing can be done to find out the fluorine levels in your water. Okay, anywhere, whatever is your source of water, even if it is municipality water, okay, bore well, the regular ground well, okay, RO water, drinking water test has to be done. You can give it to a laboratory to find out the quantity of fluorine in your water. Okay, it should be just parts per million, 1 ppm. That is the normal limit. If there is too much of fluorine, more than 2 to 3 parts per million, okay, it means you live in an area which has high fluorine level in the drinking water. You have to use RO filtration. Okay, don't drink plain water as it is. Do not drink tap water. Okay, uh, do the RO filtration. Reverse osmosis filtered water has to be taken. Otherwise, you can treat your water with alum and lime. Okay, so here you can see the good sources of fluoride. Your toothpaste, any type of toothpaste, fluorine is present. Fluoridated water supply, distilled water or drinking water, distillery water, okay, they all are fluoridated to a normal limit. Okay, mouthwashes also have fluorine. Food which is processed with fluoridated water, okay, fluorine supplements only when you do not have access to good drinking water. Fluoride supplements is required, otherwise no. Okay, or you have terrible dental hygiene and all, in that case fluoride supplements is prescribed. But your main source is drinking water. Drinking water is the main source of fluorine. In India, you can see the rate of fluorine in your groundwater. Okay, fluoride content in the groundwater, drinking water. So in the states of Gujarat, Rajasthan, and Andhra Pradesh, in now Andhra Pradesh as well as Telangana. Okay, these are the areas which have highest rate of fluorine in their groundwater levels. Okay, so these are also the states where fluorosis is very prevalent. Too much of fluorine toxicity, we can say fluorosis is very much prevalent. Okay. So this is what happens when there is a lack of fluorine. Okay, it could lead to knock knee or bow-legged. Knock knee is genuvalgum. Genuvarum is bow-legged, very similar to rickets. Okay, cases of fluorosis. Here you can see how the teeth changes. Okay, when you stay in an area which has too much of fluorine content, toxicity of fluorine. Okay, mild fluorosis, here and there you can see chalky pattern, a matte look, mattified look of the teeth. Okay, in mild cases. Moderate cases, that glossiness that your teeth should have. Teeth should have a glossy appeal. Okay, that is not there. And in severe fluorosis, the entirety of your teeth becomes completely chalky. Okay, mattified. There is no glossiness, no sheen and shine in your teeth. Okay, because of excess deposition of fluorine in your enamel of the teeth. Okay, so this is fluorosis. This happens to teeth and bones. Bones are also the areas where fluorine is stored. Okay, so too much of fluorine in the bones would lead to valgum and varum. Surgical treatment is required to change it. Okay. Coming to fluorine toxicity, acute effects and chronic effects for short term, what happens, and if you are an inhabitant of these areas, what usually happens in acute effects: nausea, vomiting, hypokalemia, tetany, that is, your hands and feet go into a state of contraction and it cannot relax. Okay, your muscles, your hands become stiff. You're not able to move it. There is no fluidity in your movements. That is tetany. Okay, hypotension, low BP, hypersalivation, too much of saliva production. Okay, metabolic and respiratory acidosis, failure of not able to kidneys and your respiratory system is not able to function properly, coma, convulsions, and in severe case, it can lead to death as well. Chronic effects, dental fluorosis, skeletal fluorosis that we have seen just now, dental and skeletal, genuvalgum and genuvarum, that is skeletal fluorosis. Dental fluorosis is the chalky appearance of the teeth. Okay. Hypersensitivity reactions, dyspepsia, that is indigestion, not able to digest food. Gastric irritation, kidneys don't function properly. There is numbness, muscular spasm. Numbness because fluorine can get accumulated in your soft tissues as well, and that leads to numbness. Birth defects, cancer. So this is the Nalgonda technique. Nalgonda is a district in Andhra Pradesh. So the all children here, okay, all the inhabitants here, 90% of them, they suffered from fluorosis, dental fluorosis, skeletal fluorosis. So a study was conducted, in-depth research was conducted. What was the cause? They found that the groundwater level of Nalgonda was too high in fluorine. Okay, so they came up with this technique. So here, when you add alum, I think it is fitkari. And what is the other name for alum in your state or region? You can mention that in the chat box. I think alum is what you call as fitkari. Do you have any other name for alum from your region? It looks like a crystal. Yeah, some names are mentioned in the chat box. Patika in Karnataka, Turti in Marathi. Okay, lime is chuna. Okay, fitkari in Hindi. Lime is chuna. Okay, that chuna that people use in pan on betel leaves, that white tuna. Okay, the same thing. So using alum and tuna, you have to mix it properly in the water that you have collected. Okay, and then allow the precipitate to settle down. Precipitate means the one that cannot get dissolved. Okay, so the mixture of this alum and tuna, it attracts all the excess fluorine out of the water. It makes a precipitate which cannot dissolve. Okay, so this precipitate has a weight and it settles down. Okay, and this sludge you can throw it out, that has settled down. Then the water, you can filter it out using you can use a normal sieve, okay, or strainer. Filter it out so that you don't drink the precipitate. Okay, with a cloth filter or a sieve filter. Okay, and then you have the final water, which is treated water. Okay, and this you can use for drinking purpose. And this is a household and community level technology. And this technology, very simple technology, very cost effective. Okay, you don't require big plants or anything. At home also, this can be done. Okay, so this was developed in India okay, in the state of Nalgonda. And it was also implemented in Tanzania. In Tanzania also, they suffer from fluorosis a lot. There also groundwater level is quite high in fluorine, okay. At household level and even in community level, community tanks, water tanks are there. In that also, you can use the same technique, okay. So equal amounts of lime and alum is mixed. It will form a sludge. That sludge has fluorine as well. Excess amount of fluorine gets undergoes reaction with lime and alum, and it settles down. It has a weight. It settles down. Okay, whatever water flows out, filter it out, and then that water can be used for drinking purpose. So this is the Nalgonda technique. Is it clear to all? Then we have the national program for the prevention of fluorosis in India. Okay. So you can see different cases of people who are children, people who are suffering from fluorosis. Okay. The first image you see is a case of dental fluorosis, severe case of dental fluorosis. Okay. Then you can see here Januvarum. Okay, an old man suffering from Januvarum, bow leg, Januvalgum. Okay. A teenager suffering from Januvalgum. Okay, this is skeletal fluorosis. So we have a national program for the prevention and control of fluorosis across India. It is strictly implemented in the states which has high levels of fluorosis: Gujarat, Rajasthan, Andhra Pradesh, Telangana. Okay. Then coming to zinc as a micromineral. Zinc is also, just like copper, is a cofactor to a lot of enzymes. Okay. And it is important in protein and your nucleic acid formation, to form certain amino acids in your body, to form DNA, RNA. Okay. Zinc is important. And if you have zinc deficiency, it leads to, in children, it leads to growth retardation, hypogonadism. That is, their gonads. In male, the gonads are their testes. In females, gonads are ovaries. Okay. So gonads will not form properly. That will affect the reproduction. Okay. Skin will change. Skin issues will come. Diarrhea. Okay. Dermatitis. These are the causes of zinc deficiency. So the main function of, just by looking at what happens to zinc deficiency, you can identify what are the functions of zinc. So definitely for your growth and development in children, okay, growth and development, zinc is required. Deficiency will lead to growth retardation. It also supports your immune system, okay, for your lymphatic, especially lymphatic immune system, zinc is required. Also helps your nerves to carry messages between the brain and body. Formation of DNA and RNA to synthesize your genetic material, nucleic acids, okay. Supports reproduction. It supports the health of your gonads, and also helps in the body to build proteins. From the breakdown of protein, you have amino acids. Using these amino acids, new proteins have to be built in the body. So for that, zinc is required. So absorption, again, zinc is from your diet, whatever zinc you get is directly absorbed by your small intestine. Okay, this is an enterocyte. Excess of zinc will be excreted from your body through feces. Okay, and once the zinc enters your blood circulation, uh, in your blood plasma, it goes to the liver for being stored there. Okay, to your bones, to your reproductive system, to your kidneys, to remove excess zinc, through filter out excess zinc out of your body. Even from the sweat, excess zinc can be lost. Towards your heart for your muscular health, to your skeletal tissue, skeletal muscles, pancreas. Okay, in all these areas, zinc will go to do its function. Okay, there are a lot of enzymatic functions zinc has to do within human body. In immunity, okay, how zinc helps? Zinc balances all your immune cells in number and its function. Okay, there are a specific reference range your immune cells should be in. Even when it comes to the white blood cells, there are 5 different types of white blood cells, and they should be in a specific range, in a healthy range. Okay, to maintain a balance between tolerance and defense mechanism, which means if there is too much of zinc or too less of zinc, it could lead to some autoimmune disorders as well. Okay, so a balance of zinc homeostasis has to be maintained. That is a balance of zinc. Okay, in when you are deficient in zinc, your body goes into a state of inflammation. Okay, your thymus gland will undergo atrophy. So in children, if they have zinc deficiency, the thymus gland is not able to produce enough amount of T lymphocytes. Okay, and T lymphocytes, whatever your body has produced, your body has to deal with those number throughout your life. Okay, once the thymus gland becomes atrophied, no more T lymphocytes will be produced in the body. Okay, uh, B cells will also be less in number. T cells will also be less in number. Okay, so that's what's happened. That will what happen in zinc deficiency. If there is too much of zinc, in case of zinc toxicity, T lymphocytes and B lymphocytes will not function properly. There will be suppression, or there will be overload of immature T lymphocytes. Okay, and your body goes into a state of macrophage, that is autoimmune situation. Too much of zinc can lead to autoimmune disorders. So zinc deficiency, there is a lot of signs and symptoms associated with zinc deficiency. These white spots that you see on your fingernails, it's very common. Okay, when this kind of white patches, if it appears on the fingernails, that's a sign of zinc deficiency. Low energy, insomnia, not able to sleep properly, infertility, because for gonads health, both in males and females, zinc is required. Loss of taste and smell, because the neural health is affected. Skin rashes, eczema, loss of appetite, low immunity, poor memory, frequent allergies and sinus problems, because macrophages, your immunity is hypoactive. Okay, breast cancer, prostate cancer, loss of libido. Okay, no interest in sexual activity, frequent colds and flu because immunity is affected, hair loss, and very slow thinking process. So those are the signs and symptoms associated with zinc deficiency. So zinc is also, in function wise, zinc is also essential to convert beta carotene into vitamin A. That is, beta carotene is the form of vitamin A from plant-based sources. Okay, to convert them into vitamin A, zinc is required. It also plays an important role in cell-mediated immunity. Okay, it also functions as an antioxidant as well as an anti-inflammatory agent. Okay, because it calms down your inflammation. So if you suffer from a lot of skin rashes, acne, dermatitis, okay, when you start taking zinc supplements, the inflammation goes down. That redness, okay, that flare-up sense redness, that goes down. So it has an anti-inflammatory action, zinc. It's also an antioxidant. And zinc is also used in the treatment of Wilson's disease. If you remember, Wilson's disease is copper toxicity, too much of copper in your body. So we know that zinc and copper are opposing minerals. So to bring down copper, you have to start taking zinc. Okay. When you start taking zinc, zinc will block the pathways for copper absorption. Okay. So that will create a balance. So to treat Wilson's disease, that is toxicity of copper, zinc supplements are used. And zinc toxicity that can also lead to nausea, vomiting, diarrhea, epigastric pain. Okay, that is upper stomach. Epigastric pain means not the lower abdomen, not the mid part, upper stomach, just below your chest. Okay, pain in that area, abdominal cramps, increased low density lipids, LDL, decreased HDL, so cholesterol issues, copper deficiency, because zinc toxicity will lead to copper deficiency. Okay, anemia, altered immune response, that is less lymphocyte stimulation, less chemotaxis, less phagocytosis. So if when any outside foreign agents are coming and attacking your body, okay, macrophages will not work. Okay, phagocytosis will not take place. Phagocytosis means your white blood cells are swallowing up the bacteria or virus and digesting them and killing them. So that is phagocytosis. That will not take place. Chemotaxis is the method in which a certain cytokines are released from the infected cells, and it's a signaling system of your immunity. Chemotaxis. Okay, so this signaling system will not work. Cytokines will not be released. Okay, that is zinc toxicity. So it will affect your immunity as well. Too less amount of zinc will also suppress your immunity. Too much of zinc will also suppress certain aspects of your immunity. So RDA of zinc, you can check from your textbook. It's usually your normal serum levels should be 60 to 150 mg per deciliter. Okay. So requirement usually is between 5 to 15 microgram per day, not more than that. So best sources of zinc in animal products, you have again shellfish, poultry, meat. All seafood are good source of microminerals. Plant mushrooms, button mushrooms, legumes, whole grains. Vegetables are also vegetables, nuts also supply zinc. But the best source of zinc is liver, beef, oyster, grapes. They are the best source of zinc. Next is chromium. So RDA of chromium is around 50 micrograms per day. So this is important for your glucose tolerance, chromium. Okay. And in the presence of chromium, your insulin can work better. Okay. The amount of insulin produced and secreted by your pancreas that can work better in the presence of chromium. Okay. So people who suffer from diabetes, chromium supplements can aid their insulin efficiency. Okay. So it is involved in metabolism, specifically glucose metabolism, because it has to work with insulin. Okay, and those who are diagnosed with diabetes, to improve your current situation, chromium supplements can help, and also it can help in athletes because they are dependent on glucose metabolism. Okay, athletes who have to consume a lot of high energy food, high carb food for energy sustenance, chromium supplement can help them. And you get chromium from legumes, apple, yeast. Okay, these are the good sources of chromium. Even to increase your glucose tolerance without getting diabetes, chromium is required. In non-vegetarian sources, liver also has chromium. Okay. Nuts, some nuts can also have chromium. But too much of chromium is also bad. It can lead to dermatitis, renal failure, kidney failure. Chromium in the form of tablets and syrup is also available, only under prescription. Okay. Then you have selenium. So RDA is around 40 micrograms per day for selenium. Maximum you can go up to 100, not more than that. So it has a lot of function. Selenium has a lot of function in your body. It can boost your immune system. It can help prevent Guillain-Barré disease. Okay, it's a cardiac disorder, Guillain-Barré disease. And it can also help prevent cancer, heart diseases. A lot of cardiac health depends on selenium, and also thyroid health. Okay, thyroid and cardiac health depends on uh, selenium. It protects against fungal and microbial infections. It regulates the thyroid hormone production. Okay, those who have hair loss, it can prevent hair loss, prevents dandruff, scalp disorders, prevention of dermatitis. It means it has an anti-inflammatory effect as well, because it gives relief from arthritis. Rheumatoid arthritis means it has an effect on has an effect as an anti-inflammatory agent. Okay, people who suffer from gout, eczema. So the main function of selenium in a human body, it can protect your heart health. It has a good antioxidant property. Okay, even your garlic. Okay, they have not shown here, but garlic, all forms of non-vegetarian meat, grains, Brazil nuts. Okay, these are good sources of selenium. But too much of selenium in excess should be avoided. It can lead to dental caries. Okay, if you are toxic, if you have reached a toxicity level of selenium, it can lead to dental caries, alopecia. You will lose a lot of hair, and it gives a garlic-like smell in your breath. Okay, even though you're not taking too much of garlic, it gives a garlic-like smell in your breath. So that's about selenium. Is it clear about this chapter? Microminerals.